Good morning, Alex and friends. I'm Grace. Today is Sunday, January 25th, 2026, and you're listening to Alex's News. The high in Riverside today is 66 degrees, with a low dipping to 48 degrees, so layers might be your best friend as we ease into the weekend chill. Coming up, we'll explore the reasons behind surging health insurance costs hitting American farmers this year, and break down the Department of Justice's decision to pull a wide-ranging request for medical records involving transgender youth, plus other key stories on global tensions, tech breakthroughs, and local impacts. All this and more on Alex's News. Stay tuned. We are following a breaking crisis in farm country that is not about weather or markets. It is health insurance. Ethan, what has changed for farmers since those Affordable Care Act subsidies ended at the very end of last year?
What changed is that a temporary set of enhanced subsidies put in place during the pandemic shut off on December 31, 2025. Those subsidies had kept premiums capped at about 8.5% of income and removed what is called the subsidy cliff. According to KFF Health News, when that support disappeared, many farm families saw what they pay out of pocket double, triple, even quadruple overnight. For a lot of them, that blew a hole straight through already thin farm budgets.
So this hit farmers harder than most other people on the individual market. Why are they so exposed?
Farmers are unusually dependent on those Affordable Care Act marketplaces because they are mostly self-employed. KFF Health News, working with NPR, reports that about 27% of agricultural workers buy coverage there, compared with only about 6% of the general public. They rarely have an employer offering a group plan the way many workers in town do. That means when the marketplace gets rocky, farmers take the full impact.
And this is happening while farm economics are already tough. How bad is the financial backdrop on the farm side?
It is rough. Prices for major crops like corn, soybeans, cotton, and dairy fell sharply in late 2025 and early 2026. At the same time, fertilizer, seed, fuel, and equipment costs are still climbing, and renewed tariffs plus cuts to USAID trade assistance are squeezing export markets. Agricultural economists told KFF Health News this is creating a classic cost-price squeeze, where fixed costs like health premiums become nearly impossible to cover.
Reporters keep comparing this to the 1980s farm crisis. Is that a fair comparison?
Rural sociologists interviewed by KFF and the USDA say the parallels are real and worrying. In the 80s, you had collapsing farm incomes, heavy debt, and a wave of foreclosures that fueled bankruptcies and suicides. Today, the fear is that unaffordable health care will stack on top of low prices and high debt, pushing vulnerable farms over the edge. One expert told NPR it looks like, quote, a slow-motion replay with health insurance at the center, end quote.
Let's dig into how premiums shot up so fast. Was this mostly insurers jacking up rates, or something else?
The sticker shock is mostly about the loss of federal help, not just insurer greed. Nonpartisan data from Medicare and Medicaid's agency, from KFF, and from the Congressional Budget Office show base premiums for 2026 plans went up roughly 15 to 30% nationwide. That is significant but not unheard of, driven by medical inflation, higher hospital labor costs, and pricey new drugs like those GLP-1 weight loss medications. But once the enhanced subsidies vanished, farm families had to absorb the entire bill, which is where you see out-of-pocket jumps of 100 to 400%.
Can you give an example of what that looks like for a typical family?
One KFF case study featured in recent NPR coverage looked at a farm family that used to pay $600 a month after subsidies. The total premium for their plan was about $2,400, and the government covered roughly three-quarters of it. This year, after about a 12% base increase and no enhanced subsidies, they are staring at the full cost, around $2,700 a month. For them, their bill basically quadrupled, and nothing else about their coverage really improved.
Are certain states seeing worse hikes than others?
Yes, especially rural states with limited insurer competition. Insurance regulators in Iowa reported average rate increases running from about 12.5% to roughly 25%. Louisiana's filings came in even higher, a little over 23% on average. The Congressional Budget Office also expects another few percentage points of pressure as healthier people drop out and sicker ones remain, which makes those rural risk pools even more expensive.
Let's talk about the people behind those numbers. Who is getting hit on the ground?
KFF Health News and NPR have followed several families that really put faces on this. In northern Louisiana, there is James Davis, a 55-year-old farmer growing cotton, soybeans, and corn. He told reporters his family premium for 2026 jumped to about $2,700 a month, roughly 4 times what they were paying out of pocket before. He said, quote, "You cannot afford it, there is nothing to discuss," end quote, and is seriously thinking about going uninsured.
And in a state like Louisiana, without Medicaid expansion, what choices does someone like James actually have?
That is the problem. Because Louisiana never expanded Medicaid, there is a coverage gap for many working-class adults. James and his wife make too much to qualify for the state's limited Medicaid program, but without subsidies, they cannot afford marketplace plans either. So they are wedged between programs, in a job where the University of Nebraska Medical Center says fatality rates are about 7 times higher than for the average American worker.
You mentioned farming is dangerous. How do injuries and health risks factor into this insurance question?
Farming combines heavy machinery, animals, chemicals, and unpredictable weather, and that adds up. Nebraska researchers estimate a typical non-fatal farm injury racks up almost $11,000 in medical bills and nearly $5,000 in lost wages. Without insurance, that kind of accident can quickly turn into long-term medical debt or even force a land sale. And KFF notes more than 1 in 5 farm households already carries over $1,000 in medical debt, often on top of operating loans.
There was also that Iowa dairy family in the NPR and KFF reporting. What is their story?
In northeastern Iowa, Megan and John Palmer milk cows and raise kids, and Megan also works part-time as a nurse. This year, their monthly premium rose nearly 90% to just under $370, with a deductible around $7,200. Dairy actually has one of the highest uninsured rates in agriculture, over 40% according to KFF. The Palmers went without insurance in the past and paid dearly for unexpected emergencies, so now Megan is job hunting off the farm for better benefits. But she worries extra hours will exhaust John and raise the odds of a serious accident in the barn.
Beyond finances, what is this doing to mental health in rural communities?
The strain is heavy. A Penn State study cited by North Carolina Health News found that more than half of farm households do not believe they could cover a major health event. That uncertainty piles onto weather stress, debt, and volatile markets, and we already know from CDC data that farmers are roughly twice as likely to die by suicide as the general population. Hotlines run by groups like the National Rural Health Association say calls from desperate producers are climbing as premiums spike.
You mentioned something called the One Big Beautiful Bill Act. How does that law make this even trickier?
That bill, passed last summer, did a few things, including changing how Affordable Care Act subsidies get reconciled at tax time. According to KFF's policy analysts, it scrapped caps that once limited how much excess subsidy people had to repay if they underestimated their income. For farmers whose incomes bounce around with weather and prices, that creates what they call a repayment trap. If they guess low now and take bigger advance credits, then have a surprisingly good year, they could owe back every dollar of those subsidies when they file taxes in 2027.
So if farmers take help, they might get hit with a huge tax bill later. How is that affecting decisions on the farm?
It is making a lot of producers more cautious and in some cases more pessimistic. Political scientist Donna Hoffman at the University of Northern Iowa told KFF Health News this new clawback risk can actually discourage farmers from expanding or trying new crops because a better year could be punished with a massive subsidy repayment. Some are choosing bare-bones coverage or skipping insurance altogether rather than risk a future tax shock. It feeds into that sense that the rules are stacked against independent operators.
Let's get to Washington's response. The Trump administration rolled out something called the Farmer Bridge Assistance Program. What does that do, and what does it not do?
The Farmer Bridge Assistance Program, announced in early December, sets aside about $12 billion in one-time payments meant to land by late February. Row crops like cotton, corn, and soybeans get targeted per acre rates, so a mid-sized farm might see around $20,000 in relief. USDA and farm groups told outlets like Daily Kos that money helps cover tariff and input losses. But health policy experts point out it does nothing to lower monthly premiums. Often, that check is spent on feed, fuel, or banknotes long before the health insurance bill comes due.
Congress also passed that big OBBBA law you mentioned, with higher reference prices and some health tweaks. Does that help with coverage?
Not much in the short term. The law does raise benchmark prices for commodities like soybeans, corn, and wheat by roughly 10 to just over 20%, but those payments do not start flowing until October 1st of this year. On the health side, it encourages health savings accounts for cheaper bronze or catastrophic plans, which can help with deductibles. But as analysts told Health Leaders Media, that does not change the fact that many farmers still cannot afford the premiums or find local doctors and hospitals within a workable distance.
On Capitol Hill, what are the main proposals to actually bring back those ACA subsidies?
In the House, there is a bill called the Breaking the Gridlock Act, H.R. 1834. It passed on January 8th, just over 2 weeks ago, with a small group of Republican votes, and would restore the enhanced subsidies for 3 more years. Over in the Senate, Susan Collins and Bernie Moreno have a more limited plan, the CARE Act, which offers a 2-year glide path where help gradually tapers off and phases out for households above about 700% of the poverty level or $200,000 in income. According to bill trackers and outlets like ABC News, talks stalled this month over disagreements on health savings accounts and deficit impacts, and President Trump has warned he will veto any extension that does not include broader Affordable Care Act changes.
While lawmakers argue, what alternatives are farmers turning to right now?
Some are moving into Farm Bureau-sponsored health plans, which are now offered in about 13 states including Iowa, Missouri, Nebraska, and Tennessee. Those memberships can cut premiums by 30 to 50% compared with Affordable Care Act plans, according to trade press. But the American Medical Association and rural consumer advocates stress these are technically not insurance, they are medically underwritten, and they can exclude pre-existing conditions or skip essential benefits like maternity care or mental health. They work reasonably well for young, healthy families, and much less well for older or sicker farmers.
Louisiana is experimenting with association health plans for small farms. Are those any better?
Louisiana's new law, known as SB 16, took effect at the start of this month and changes how stop-loss insurance works for those associations. In theory, small farms can band together to buy coverage more like a big employer group. But critics cited in policy outlets and think tanks say many of these products are still loosely regulated. They often lack firm caps on out-of-pocket costs, so a serious illness can still blow through family finances.
How many rural people are expected to just drop coverage altogether because of all this?
KFF's latest estimate, released on January 22nd, just 3 days ago, suggests that by today, roughly 4.8 million rural Americans will have given up coverage. Farmers are disproportionately represented in that group. In Pennsylvania alone, researchers told NPR that at one point during the enrollment period, more than 1,000 people a day were terminating policies. Some are gambling they will stay healthy. Others are saying they will find off-farm work just for benefits.
What does that wave of uninsured people mean for rural hospitals and clinics?
Rural hospitals were already on shaky ground, and this adds another layer of risk. Uncompensated care, where hospitals treat uninsured patients and never get paid, is projected by consultants like Manat Health to cost non-expansion states such as Louisiana more than $12 billion this year. That kind of hole can push small facilities to cut services or close entirely, deepening what public health experts call provider deserts. Then even insured farmers face long drives and delayed care, which again raises the odds of bad outcomes.
If nothing changes in Washington by spring, what do experts say happens next in farm country?
Analysts at the University of Illinois and other ag schools warn that we could see more farm closures, higher medical debt, and rising injury and suicide rates. Average total costs for a farm injury are already in the mid-five figures when you combine treatment and lost work, and without coverage, families may be forced to sell assets or take on high-interest credit just to get stitches or surgery. Industry voices like Michael Klein from USA Rice have told Pro Farmer they are bracing for a mental health wave that looks uncomfortably like the 1980s. As one KFF Health News piece put it, without a bipartisan deal, America's breadbasket is at real risk of breaking under the weight of unaffordable care.
So for now, farmers are facing higher premiums, riskier stopgap plans, or no coverage at all. Ethan, thanks for walking us through the stakes behind those numbers.
You're welcome, Grace.
Our next story is about a major shift in a federal fight over transgender youth medical records. Chloe, what exactly did the Justice Department just back away from?
3 days ago, on Thursday, January 22nd, the Justice Department quietly filed an agreement in federal court to withdraw a sweeping subpoena aimed at Children's Hospital Los Angeles, according to CalMatters. That subpoena had demanded personal and medical records tied to more than 3,000 transgender patients, many of them kids and teens. By withdrawing it, the department effectively ended a high-stakes legal battle that had dragged on since last summer. Lawyers for the families say it is not just a procedural move, but a big statement about the limits of federal power over private medical information.
And why are legal advocates framing this as such a big win for privacy, especially in California?
The agreement protects any identifying details, things like names, birth dates, social security numbers, home addresses, and parents' names, from being handed over, CalMatters reports. Those protections also cover treatment records tied to puberty blockers and hormone therapy, and they are locked in at least through February 2029. Attorneys from the group Lawyers for Good Government called it a defense of, quote, the basic legal right to medical privacy, end quote, and they are now moving to dismiss the class action lawsuit the families filed last November. In a state that has positioned itself as a sanctuary for gender-affirming care, advocates see this as a crucial test of whether federal investigators can pierce those protections.
Let's back up to how this even started. What was the Justice Department looking for in the first place?
The subpoena hit Children's Hospital Los Angeles on June 11th of last year, and LAist reports it was extraordinarily broad. The government demanded everything from intake forms and mental health notes to insurance claims, prescription records for puberty blockers and hormones, even personnel files for staff involved in care. The official justification was a probe into possible healthcare fraud or so-called misbranding under the Food, Drug, and Cosmetic Act, because many of these medications are used off-label for gender dysphoria. But as of today, no concrete examples of fraud have been produced, according to analyses by Politico Pro and CalMatters.
Off-label use sounds technical. Why did that become the centerpiece of this investigation?
In medicine, off-label use means prescribing an FDA-approved drug for a purpose the label does not specifically list, and it is extremely common in many specialties. The Trump Justice Department, under Attorney General Pam Bondi, argued that using puberty blockers and hormones this way amounted to misbranding and possibly false billing to federal programs. Legal and medical experts quoted by CalMatters note that major professional groups, like the American Academy of Pediatrics, endorse these treatments as medically necessary for some youth. So to them, using off-label rules as a fraud hook looked less like a neutral legal theory and more like a way to target gender-affirming care specifically.
Did the government ever provide examples to back up those fraud claims at Children's?
No, and that became a central issue. Khadijah Silver, who heads Gender Justice and Health Equity at Lawyers for Good Government, told CalMatters the subpoena was a, quote, fishing expedition, end quote, because the department never pointed to a single questionable bill or chart. In the settlement papers, the Justice Department even says it is, quote, not currently aware of information that would support the federal prosecution of parents or guardians, end quote, who sought care at Children's Hospital Los Angeles. LAist reports that experts read that line as a quiet admission the probe was driven more by ideology than by evidence.
How did the hospital itself respond when this huge demand for records landed last summer?
Children's Hospital Los Angeles did something that a lot of providers, frankly, are afraid to do. It refused to turn anything over. According to court filings cited by CalMatters and Yahoo News, the hospital never produced the patient documents the Justice Department wanted. Lawyers for the families say that firm's stance was pivotal because it forced the federal government either to defend the subpoena in court or retreat. The hospital has stayed pretty tight-lipped publicly, describing itself as nonpartisan, and it declined to comment to multiple outlets, including CalMatters and Yahoo.
This was not the only hospital under the microscope. How does this case fit into what we are seeing nationally?
The subpoena to Children's Hospital Los Angeles was part of a broader Justice Department initiative, announced last summer, targeting more than 20 clinics and hospitals that treat transgender youth. Just days before this settlement, a federal judge in Baltimore threw out a very similar subpoena aimed at Children's National Hospital in Washington, D.C. The Los Angeles Times reports that judge said the government appeared motivated by, quote, fear rather than legitimate need, end quote. Institutions in places like Colorado and Pennsylvania have faced comparable demands, and some have also pushed back successfully.
You mentioned a class action suit by families. When did that begin, and what were they arguing?
7 families stepped forward on November 15th of last year, filing a lawsuit known as Doe versus Department of Justice in federal court in Los Angeles. As the San Francisco Chronicle outlines, they argued the subpoena violated constitutional privacy rights under the 4th and 14th Amendments, and also ran afoul of federal medical confidentiality laws. Their claim was that the investigation was not really about rooting out fraud, but about intimidating families and creating a paper trail that could be used to prosecute them in states that have banned gender-affirming care. They also feared administrative actions, like cutting off federal funds, based on whatever the Justice Department might find.
So in the end, what exactly does the settlement they reached do and not do?
The deal gives the Justice Department a narrow path to seek some aggregate anonymized data, but it blocks them from getting any personally identifiable information for these patients. Children's Hospital Los Angeles is explicitly allowed to redact or withhold sensitive details in future requests, and the agreement bars new subpoenas for identifiable records tied to this care until at least 2029, CalMatters reports. Importantly, the department did not admit wrongdoing, but the families got what they most wanted, a hard legal barrier between the government and their kids, names. After that, their lawyers asked the court to dismiss the class action case, because the immediate threat to privacy had been addressed.
Where does California's own legal framework come in here? The state has passed several laws around transgender care.
California has been building a legal wall for a few years now. The Los Angeles Times notes that Attorney General Rob Bonta leaned on laws like the Transgender, Gender Diverse, and Intersex Inclusive Care Act, known as Senate Bill 923, and the Transgender State of Refuge Act, Senate Bill 107, to argue against federal overreach. Those statutes require insurers to cover gender-affirming care and tell state agencies not to cooperate with out-of-state prosecutions or subpoenas targeting that care. While Bonta's office did not formally intervene in this particular case, he filed amicus briefs in similar fights and sued to block Executive Order 14,187, which threatens federal funding for providers who treat transgender minors.
You mentioned that executive order. How does it connect to what happened at Children's Hospital Los Angeles beyond the subpoena?
Executive Order 14,187 is part of a larger package of Trump administration policies rolled out last year that try to narrow legal recognition to only two biological sexes and restrict transgender participation in sports and school programs. That specific order put hospitals on notice that if they provided puberty blockers or hormones to minors, their federal funds could be at risk. According to internal documents obtained by LAist and the Los Angeles Times, Children's Hospital Los Angeles relies on federal dollars, mainly through Medicare and Medi-Cal, for about 2/3 of its budget. Administrators warned staff in a June 12 memo that if those funds were cut off, the hospital might survive only about 50 days.
And that financial pressure led to the closure of their gender clinic, right? What did that look like?
Yes, and for many families, that closure is the deepest wound. On July 22nd last year, the hospital publicly announced that its Center for Trans Youth Health and Development, one of the oldest pediatric gender programs in the country, would shut its doors to new patients under 19, according to CalMatters. Behind the scenes, leaders explicitly linked that decision to the Justice Department subpoena, Attorney General Bondi's memos, and federal reviews by the Health and Human Services Inspector General. They described the move as heartbreaking but necessary to protect emergency and essential services for all children, since losing federal funds could threaten the entire institution.
Were there other reasons given, like internal disagreements or malpractice cases?
Not in any formal way. CalMatters reviewed board minutes and court filings from the past couple of years and found no indication that clinical disputes, staffing issues, or routine finances were the main drivers of the closure. There was a single detransition lawsuit mentioned in legal risk assessments, but it was treated as secondary to what leaders called a, quote, complex and uncertain regulatory environment, end quote. The clear through line in the records was federal pressure, not a sudden loss of faith in the care itself.
How have community members and patients responded to all of this at the local level?
The backlash started even before the closure was final. Back in February of last year, protesters gathered outside the hospital, holding signs and speaking out against what they saw as a politically forced shutdown, and CalMatters published photos from that day. Families described being left in limbo, with about 3,000 young people suddenly unsure where to get ongoing care. Many told reporters they felt betrayed by a system that had told them to trust doctors and then abruptly cut off the clinic those doctors worked in.
The settlement protects past records, but what does access to care look like now, going forward?
That is where advocates say this victory feels bittersweet. Children's Hospital Los Angeles still offers some mental health support and care coordination, but it no longer initiates puberty blockers or hormones for minors, so families are being pushed into private practices or community clinics. The San Francisco Chronicle and LAist report that other major pediatric systems, including Rady Children's in San Diego and Children's Hospital of Orange County, announced just last week they will stop gender-affirming medical treatments for minors as of February 6th. All told, that adds roughly 4,000 more young patients facing disrupted or delayed care.
So even with California's so-called sanctuary laws, are families actually finding places to go?
It is getting harder. Senate Bill 107 does mean that past records at places like Children's Hospital, Los Angeles, are largely shielded from hostile subpoenas, and Senate Bill 923 tells insurers they still have to cover this care. But with big hospitals stepping back, those legal guarantees are colliding with a shrinking provider list. Wait times at clinics like the Los Angeles LGBT Center, St. John's community health sites, and some university programs have stretched to 12 to 18 months, and many families are being pointed to an LGBTQ+ healthcare directory to hunt for private specialists they may not be able to afford.
What are advocates and state officials trying to do next to change that trajectory?
Attorney General Bonta and a coalition of more than 15 states are still suing over the 2025 executive orders, but those cases have not been resolved yet, so hospitals are acting under the cloud of possible federal penalties. Equality California and other advocacy groups are urging people to file public comments on proposed federal regulations that would formalize funding bans for hospitals providing this care, with a key deadline coming up on February 17th. In the meantime, some families are telling outlets like CalMatters they are considering moving to other countries because they do not trust that state protections can outweigh federal power. It is a stark example of how policy fights in Washington are playing out in individual households.
And how are regional outlets framing this for communities that may feel far from Los Angeles or Washington?
A Central Valley outlet called the Merced Focus, which partners with CalMatters, put this story on its homepage this month as part of a broader look at health equity. They connected the transgender care crackdown to more familiar local issues like therapist shortages and high asthma rates from air pollution, arguing that vulnerable youth always feel policy shocks first. That framing helps residents see that this is not just an urban or coastal issue, but part of a statewide struggle over who gets consistent, specialized healthcare. It also underscores that even a legal win on privacy can still leave big gaps in actual services.
Bottom line, then, what should listeners take away from this latest turn in the Children's Hospital Los Angeles case?
The Justice Department's withdrawal shows there are real legal limits on how far the federal government can reach into confidential medical records, especially when the underlying claims of fraud are unsubstantiated. For transgender youth and their families, that means their histories at this hospital are safer from becoming evidence in ideological battles. But as CalMatters, the Los Angeles Times, and others have pointed out, the care infrastructure itself is shrinking, and that is not fixed by this settlement. As Khadija Silver put it, this agreement is, quote, one piece of a large, very important puzzle, end quote. The fight now is making sure there are still clinics open when families knock on the door.
A complicated mix of relief and uncertainty for a lot of families right now. Chloe, thanks for walking us through it. Here are some other headlines. In the United States, the race to the ballot is turning into a sprint to the passport. New reports show a paradoxical surge in naturalization as immigrants rush to become citizens before rules tighten further. NPR cites a 109% spike in applications in late 2025 as residents tried to dodge a tougher citizenship test. But the road to naturalization is now more obstacle course than open door. The Guardian and immigration firm Grossman Young and Hammond report an indefinite pause on visa processing for 75 countries, plus expanded, high risk, holds freezing final decisions for nationals of 39 countries. USCIS has shifted to a law enforcement first posture, rolling out a Homeland Defender's task force to ramp up fraud probes. Advocates warn it could defend the homeland by shrinking it. The National Partnership for New Americans says approval rates could fall, even as millions see citizenship as a defensive shield against possible denaturalization drives and further shifts before the 2026 midterms. The Niskanen Center notes that a massive front log of unopened cases has nearly doubled, threatening to turn lines for citizenship into waiting rooms for democracy, with hundreds of thousands potentially unable to register to vote in time. In Myanmar, the ballot box is being used as a strong box for military power. The country has wrapped up the third and final phase of its general election, held Sunday, January 25, 2026, an exercise the United Nations and Western governments condemn as a sham. The military-backed Union Solidarity and Development Party entered the last round, already holding more than 80% of contested seats from phases on December 28 and January 11. The vote excluded the National League for Democracy, dissolved by the junta in 2023, while its leader Aung San Suu Kyi remains jailed. China backs the election as a step toward stability, but critics say it's stability in name, immobility in practice. Under the 2008 Constitution, 25% of parliamentary seats are automatically reserved for the armed forces, making the system less an election than a selection. Turnout in earlier rounds hovered around 52 to 55%, with many opposition groups refusing to recognize the results. A new parliament is due in March, followed by a military-approved government in April, formalizing a shift from overt junta rule to what many call camouflage democracy. In Indonesia, rescue workers are in a race against time and terrain after a deadly landslide in West Java. At least 16 people are confirmed dead, and about 80 remain missing after mud buried roughly 34 homes in Pasir Langu village, West Bandung Regency, on Saturday, January 24th. Heavy monsoon rains have turned the search into a slog, forcing operations to pause overnight before resuming with drones, sniffer dogs, and manual digging. The National Disaster Management Agency has put the region on emergency alert through April 2026, warning that mountainous communities are increasingly at risk as deforestation eats away at already fragile slopes. Last year, floods and landslides killed more than 200 people in Sumatra alone. Local reports say over 20 soldiers may be among the missing, adding a military dimension to a disaster already testing Indonesia's response to a stormier future. In Iraq, politics is going back to the future. The powerful Coordination Framework Bloc has officially nominated former Prime Minister Nouri al-Maliki to lead the next government, after caretaker Premier Mohammed Shia al-Sudani withdrew from the race. Chosen at a meeting in the office of bloc leader Hadi al-Amiri, Maliki was backed on the basis of his political and administrative experience from his 2006 to 2014 tenure. Some Sunni factions, including the AZM Alliance, support the move, while others warn against recycling leaders. Parliament is slated to elect a president on January 27th, who would then formally tap Maliki to form a cabinet as Baghdad struggles to balance U.S. pressure, Iranian influence, and the role of Tehran-aligned militias. And on the transatlantic front, a war of words has led to a peace of mind, at least for one ally. After saying in Davos on January 22nd that NATO partners had stayed a little back, in Afghanistan, President Donald Trump has reversed course, praising British forces as the greatest of all warriors. His Truth Social post, highlighting the 457 British troops killed in Afghanistan, followed a tense call with Prime Minister Keir Starmer after Starmer, Prince Harry, and bereaved families condemned the original remarks as insulting and appalling. Trump's rhetorical U-turn stressed an unbreakable bond with London, an attempt to ring-fence the special relationship, even as allies like France, Italy, and Denmark remain angered. Diplomats warn the fallout has tested NATO cohesion and stirred rare united criticism across the UK political spectrum and the quasi-archaical Tibet monarchy, underscoring how sensitive the legacy of the Afghan war remains on both sides of the Atlantic. That's all we have for now. Today's episode was made by Alexander King with GPT-5, Gemini Pro 3, Gemini Flash 3, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.